Okay, so chapter 7, it's about the skeletal system. So we're going to see the divisions of the skeleton, and we're going to start identifying in the bones of the skeleton the different markings, which are parts that makes them unique. And then we are also going to see a specific bones for cranial, facial bones, the orbit, the nasal cavity, and the paranasal sinuses. We are also going to see differences between the infant, the fetal skull, and adult skull, and we're going to see what are the bones of the vertebral column, what are the regions, the numbers, their anatomical differences, and we're going to see as well the thoracic cage, the intervertebral disc, and the bones of the upper and lower limbs. So basically, we're going to see everything. Now, as a reminder, the functions of the skeleton will be to support, protect vital organs, also allowing the point of attachment for muscles so that you can move and then you can manipulate the environment, and production of blood cells, storing minerals, and helping us to maintain body shape and posture. So it provides a structure to our body. So those are the functions. Now, our human skeleton, the adult human skeleton, has 206 bones. And then out of these 206, we have the subdivision. The bones that are located in the central part of our body, which is the axial skeleton, and the bones that are located in the upper and the lower limbs. That will be the appendicular skeleton. That's the major subdivision. So, now, the bones, they're not featureless. So they have bumps, they have depressions, they might have holes through them, and these are generically called markings. So markings are surface features that serve important roles. So we have three main types of markings. We have depressions, openings, and projections. So depressions are indentations or grooves. Examples will be fossa or notches. And within these depressions, we have the passage of arteries, veins, or nerves. Or also, within these depressions or notches, we can have other bones connecting, so you form joints. So the connection between bones is called a joint. And then for openings, so openings or holes, they serve a purpose. They allow the passage of arteries, nerves, and veins. And then examples of these openings will be foramina. Foramina is plural for foramen. So foramina is plural of foramen. And then we also have canals and fissures. Canals are not completely going through the bones, the holes, but it's an opening. And then fissures are jagged edge openings. No matter if it's a canal, a foramina, or a foramen, no matter if it's a foramen, a canal, or fissure, you have passageway to blood vessels or nerves. Now, projections are raised areas or bumps. So examples will be processes, tuberosities, trochanters, tubercles, and these bumps or these processes helps for muscles to attach, also for ligaments to attach, and for tendons to attach, and they may form joints. So here we have examples of each of these classifications, these features. So depressions, we have a facet. A facet is a shallow or concave surface, like this one in here, that is the articular facet of the rib, where two bones articulate. So what bone articulates in the articular facet for the ribs? Well, in this case, this one, which is located in an area, this articular facet for the rib is located in an area of the rib that is called a tubercle. So the transverse process of the thoracic vertebrae attaches into here, into this facet. So it's a shallow, convex, or concave surface. So that's an example for a facet. Now, for fossa, or fossae, the plural, that's an indentation in a bone. So another part of a bone fits into a facet. So in this case, you are looking at the distal end, the posterior part of the humerus. So in this part, the humerus has a fossa that is called olecranon fossa. And the elbow bone that we call the olecranon process, part of the bone that we call the ulna, the actual medial bone in the anatomical position of our forearm, it fits into here. So our elbow bone fits into here. The olecranon process of the ulna fits into the olecranon fossa, which is an indentation in the distal part, posterior part of the humerus. Now, foveas are shallow pits. So in this case, we are looking at the proximal end of the femur, which is the thigh bone. And this part of the femur in here, this projection is actually called the head of the femur. And in the head of the femur, in this part, which is the middle part, we have a shallow pit that we call fovea capitis. Capitis means head. So it's a shallow pit in the head. A ligament that is called the round ligament fits into the fovea capitis. And that holds the head of the femur into the coxal bone. So first, capitis. Capitis means head. Capitis or caput means head. So then, in this fovea capitis, so this is the neck of the femur, and this is the head. And here you have the trochanters. So this is a trochanter. This is the head. So you have this little shallow pit, which is the fovea capitis. So you have a little ligament that is called the round ligament. So the round ligament connects this head into the, so this is the femur. into the coxal bone. And then we have grooves or sulcus, sulci for plural. So this is a long indentation along a narrow structure. In this case will be along the body of the ribs. So this is the body of the ribs. This is the head of the rib, has the neck, has the tubercle, and this is the body or shaft. So underneath the edge of the body or the shaft, you have the costal groove. Within the costal groove, you have a vein, an artery, and a nerve running. And in that order from lateral to medial. So if this was the rib, this is the head, and if this is like the lower border of the shaft, so you have, this is lateral and this is medial. And the ribs, the proper name is called costae. It means ribs. So in this region, so let's say this is the costal groove. You have a vein. Then you have here in the middle an artery. And then you have a nerve. So lateral to medial. Vein, artery, nerve. And these are called intercostals. Why? Because they are in between the ribs. If someone has an injury, guys, to the thoracic area, they get stabbed and they accumulate fluid, like blood or pleural fluid. In order to extract that fluid, they have to insert a catheter, but they have to do it through the superior border of the edge of the rib, not the inferior border. Why? Because they will damage the vein, the artery, or the nerve. Now, in physiology and in anatomy, you will have to understand that there is this, I guess, from my perspective, it's a principle on which the structures that are more internal or more deep are more fragile. So you have to protect them. So in order of importance, then the nerve is more important for function than the artery, and then the vein is less important. That's why the vein is protecting the artery and the nerve. And both the vein and the artery protects the nerve. Okay? So I will repeat that over and over again. I mean, God doesn't make mistakes. He made it that way because of that reason. Okay? So now, for the next features, which are openings. So we have canals or meatuses. So it's a tunnel through a bone. Example will be here in the temporal bone. This is the lateral view of the temporal bone. So this opening is called external acoustic meatus. So basically it's our ear canal. It allows the entry of sound waves so that they can hit the tympanic membrane that we have at the end of this canal, so that the tympanic membrane vibrates and then we can hear. So it's a tunnel, a canal, or a meatus. Now, fissures, which are slit-like openings in a bone, that happens between adjacent parts of the bones or bones, like the ones that we have here in the orbit. So remember, the eye region is called the orbit. So if you remove the eyes and then you see the bones from the orbit, posteriorly we have bones like the sphenoid, the ethmoid, the palatine bone, the zygomatic bones, and then we have here this fissure, which is called the superior orbital fissure, that is part only from the sphenoid, but we have also another one that is called the inferior orbital fissure. It's not shown really well in here, but that is made by different bones. And what passes through these fissures? Well, in this case, arteries, veins, and nerves passes through these fissures that help us to move our eyes, and then we can focus the vision. And then for foramina, or for foramen, it's a hole in a bone. So for instance here, this is the frontal bone, the forehead bone is called the frontal bone. Above the orbit, so basically above our eyes, we have the supraorbital foramen. If you take into account both, will be supraorbital foramina. So we have a nerve that passes through this supraorbital foramen, which is the supraorbital nerve. It's just in your eyebrows. And sometimes we have it halfway open. In that case, it's a notch, it's not a foramen. But it is close to the bridge or the root of the nose. And then if you feel like a little indentation there, if you compress it for a while, you will start feeling numbness in this area. Well, it is because you're compressing the supraorbital nerve. More markings. So we have projections like condyles, which are rounded ends of a bone that articulates with another bone. So this is the mandible. And then the mandible has a superior posterior projection that is called the mandibular condyle. This mandibular condyle articulates with the temporal fossa of the temporal bone, and they form that TMJ, temporomandibular joint. And actually, out of the skull joints that we have, this is the only one that we move, the TMJ. But we don't move these articulations between parietal and frontal, occipital. We don't move them at all. Why? Well, because we are protecting the brain and all that is internal here in the cranial cavity. But why do we need to move the TMJ, the temporomandibular joint? To eat and speak. And sometimes when we will be talking about articulations, guys, and how we classify them according to movement. There are some articulations that they don't move at all, or some that slightly move, but sometimes we either slightly move our TMJ or not move it at all, because we hurt others when we speak. Okay, so some people have diarthrosis. Well, this is a diarthrosis, it's freely movable, but we shouldn't be excessively talking. Anyway, that's a condyle. Now for a crest, it's a ridge or a projection, and it's narrow. So here we have the medial view of the coxal bone articulating actually with the coccyx and with the sacrum. So this crest, it is part of the iliac bone. So this is the iliac crest. It's easily felt when you put your hands like this. So that's the iliac crest, where you sit your hands. Like Wonder Woman. Now, heads. Heads are rounded projections. They are bigger than condyles. Condyles, they have like kind of an oval shape, but the heads are almost circular. And then we have heads in several bones, including the humerus, which is our arm bone. So this is the humerus head. And then we have it as well in the femur. We have it as well in the ribs. And now for the tubercles and tuberosities. So they are small rounded projections. A tuberosity is larger than a tubercle. So here in the shaft of the humerus, laterally, we have a projection that is called deltoid tuberosity. Our deltoid muscle, the shoulder muscle, inserts in this tuberosity. Okay? And we have a tuberosity in the tibia, just below the patella. Okay, so that's where a tendon inserts. And then we have epicondyles, which are raised areas above a condyle. So in this case, we have in the distal end of the humerus a medial epicondyle, and then here we have a lateral epicondyle. So this is the lateral epicondyle of the humerus, and this is the medial epicondyle. If you have hit this against an object, you know how painful it feels in here, in this region. It's because between the trochlea of the humerus, which is here, and the medial epicondyle, we have the running of the ulnar nerve. And when you hit it, you are compressing the ulnar nerve, and that creates that painful sensation. Some people, they call it funny bone. I mean, you can have tingling, but still you feel pain. I don't know what's funny about that, but they call it funny bone. Okay, so that's the medial epicondyle. And now processes are prominent bony projections, like for instance here, in this bone, the upper back bone, which is called the scapula, we have a process that is called the coracoid process. And then spine is a sharp process. So here we have also in the scapula, the spine of the scapula, which is easily felt when you just start touching your upper back. Okay, that projection that you feel there, that bony projection, that's the spine of the scapula. It's a sharp process. So more projections. We have protuberances, which are outgrowths from a bone. We have few protuberances, and an example will be the external occipital protuberance in the occipital bone. So this is a posterior view of our skull. So this is the external occipital protuberance. This is the most prominent part of our back, of our skull. And that one is easily felt. If someone falls in their back and they don't have any protection at all, they don't put the hands or the arms to protect hitting his head, that's the first part that you hit. And also it's very painful, okay, to hit. Now, trochanters are large projections, and they're only found in the femur. We have one that is called the greater trochanter, which is lateral and then is proximal. It's anterior, lateral and anterior, to the lesser trochanter, which will be here, that is medial. So this is the femur, this is the proximal epiphysis, and this is the distal epiphysis. This is the posterior view. I don't know if I said anterior, but these are located posteriorly. So the lateral and posterior will be the greater trochanter, and the medial and inferior and distal will be the lesser trochanter. Now, this part between the greater and the lesser trochanter will be called the intertrochanteric crest. And then anteriorly, we have an intertrochanteric line. The line, it is less prominent than the crest. And now, we also have lines which are long, narrow ridges, like this one, that runs here between the intertrochanteric crest and the medial epicondyle of the femur. This part is the medial epicondyle of femur. Now, this line that runs then between the middle part of this intertrochanteric crest and the medial epicondyle is called linea aspera. Line in Spanish is linea, and aspera means rough. So this is the rough line. In here, we have several muscles that attach into this linea aspera. It's a long, narrow ridge. So those are definitions and examples. So we will be looking at more of these when we will be exploring all the skeleton. Now, as a reminder, the axial skeleton, it is found in the central part of the body, and it is made by the bones of the skull, vertebral column, thoracic cage, and the functions of this axial skeleton will be to support and protect. This is the most protective skeleton that we have. Why? Because it protects the brain, spinal cord, lungs, heart, great blood vessels. Appendicular skeleton function is movement. We have it in the upper limbs, lower limbs, and also in the pectoral girdle, which is made by the clavicle and scapula. So our pelvic girdle is made by the left and the right coxal bones, what we commonly call the pelvic bones. So here is the structural divisions. Everything here in orange will be axial. Everything here in beige will be appendicular. So now let's look at the individual bones from the axial skeleton. So for the cranial and facial bones we have 8 in total. We have some that are paired, like parietal bones and temporal bones that are paired. So we have left and right parietals, and then we have left and right temporal bones. The rest are not paired. So we have one sphenoid, We have one occipital bone and one ethmoid and one frontal. Functions of the cranial bones to protect the brain. And then these bones are located either in the cranial vault or roof, which will be this, which is called also known as calvaria, or they can be located at the cranial base, which we know as the floor. And then all of the bones of the skull joined by immovable sutures that we call, we will review this again, but let's start looking at movements of the bones. So synarthroses are non-movable joints. And that specific name of the immovable joints from the cranium are called sutures. Sutures have jagged edges between the bones. They are interlocking. So this is, let's say, frontal bone, and then below you will have, posterior, you will have parietal bone. So this is the coronal suture. And then you have collagen fibers in between. Now, for facial bones, we have 14 facial bones. So they provide a structure to allow the insertion of the muscles of the face, the facial muscles, and helps to support entrances to the digestive and respiratory tract. So we form, for instance, the nasal cavity and the oral cavity with these bones. And then what are the facial bones? Well, we have the mandible, which is the jawbone that we colloquially known as the jaw. Vomer, which is in the nasal cavity inferiorly, just above the maxilla, which will be this bone in here. And then we have the cheekbones that we call zygomatic. Zygomatic are paired. We have the nasal bones, which are located at the bridge of the nose. Okay? And we have lacrimal bones that are located inferiorly and medially in the orbit. Lacrimal So the lacrimal bones have a canal to drain the tears. Tears, you call it lagrima in Spanish. That's how the name came from. Okay? And then we have in the roof of our mouth, if you stick your tongue up, you feel something hard, that's the palatal bone. And then within our nasal cavity, we have nasal conchae. One of it is the inferior nasal conchae that it is considered a separate bone. So all of these are facial bones. And mandible is the only movable bone from the skull. Now, it's not cranial, it's not facial, but it is considered within this part of anatomy. We have a bone that it looks like a horseshoe shape that is called the hyoid. The hyoid bone is the only unarticulated bone in our body. It is suspended into our body or hold by ligaments and muscles. It's located here in the above portion of our neck, in the superior portion. This bone, it is interesting because it helps for swallowing and also supporting the tongue because several muscles of the tongue inserts into there. But it can be also used for forensics investigations. Sometimes people get murdered rather than committing suicide by hanging. And when that happens, sometimes the murderers, what they do is they hang the body and then try to pretend like if it was a suicide by hanging. Well, when someone commits suicide by hanging, typically, if the person is not very old and the bone is not osteoporotic, typically the rope slides over the hyoid and never breaks it. But when someone is murdered by strangulation, that force, physical force, typically breaks the hyoid. And that's an evidence for a strangulation. Okay? That's one. Another one. When someone gets slaughtered by a knife in the neck, they slash it like that. Since this little bone is only hanged by ligaments and muscles, sometimes it can fall out from the body. And that's another evidence. Okay. So here is the angle view of these cranial bones. So these bones will be forming the calvaria, and these bones in here will be forming the floor in this region. So here is the frontal, which is the most superior and anterior bone of the skull. And then here we have the parietal. This is the right parietal bone. And then below the parietal, but anterior to the occipital, which you can only see a portion in here, we have the temporal bone. And then between between the temporal bone, the parietal bone, and the frontal bone, we have the sphenoid, as seen laterally. This bone, you can see only one tiny part. You can see it better through the inside. This part that you can see from the sphenoid is called the greater wings, or greater wing of the sphenoid. Every single bone of the skull connects to the sphenoid. It's the keystone. Now, when someone shuts itself by putting the gun in here, in this region, they put it here in the sphenoid, in the greater wings. They blow it, and they blow the connection to every single bone. So this is the greater wings of the sphenoid. Now, the ethmoid, which is here, you can see it in the internal part of the orbit, but you can see it also here in the nasal cavity, superior to this bone, which is the vomer. So this is the ethmoid here and here. And then for the facial bones, we have the nasal here, just below the frontal, and medial to the maxilla, which is all this. And then posterior to this part of the maxilla, we have the lacrimal. And then here, you can see the inferior nasal conchae. This is the nasal cavity. And then this is the vomer. And here we have the mandible and the zygomatic, which will be the cheekbones. Any questions about the facial bones? These are just the names, and the cranial bones. Okay. So now for the individual bones, you can see them better. Frontal is very broad, forms the forehead. Parietals are also broad, forms part of the lateral part of the calvaria. And here is the occipital bone, which forms most of the part of the posterior part of our skull bone. And then the temporal, which is located here where we have our ears. It is a tiny bone. That part of it will form part of the cranial base, which is all this. So you can see here the sphenoid, and then the palatine bone connecting to the sphenoid. Here is the ethmoid, and here the zygomatic, maxilla, left and right, mandible, inferior nasal conchae, vomer, lacrimal bones here, and then palatine is underneath here. But you can see a tiny portion in here as well. Hyoid, horseshoe shape. In this case, they're showing this muscle that is called digastric. But this bone, which is above the larynx, which is our voice box, has this body, these lesser horns above the body. So this is the anterior view of this bone, and then these greater horns. So the horns faces superiorly. And then again, this is a tiny bone that is only held by ligaments. Like this ligament is called the thyrohyoid membrane, and some muscles. So functions is to support the tongue and assist in swallowing and speech. It can modify the voice. Now, for cranial fossa. So we have three cranial fossas. They are located in the floor or the base of our cranial cavity. We have anterior, middle, and posterior cranial fossa. And the function is to hold different organs or parts of the brain. Like the anterior cranial fossa supports the frontal lobes of the brain. Our brain is subdivided into segments, and we call them lobes. So the frontal lobes are in contact with the frontal bones. And they are supported, these frontal lobes, by the anterior cranial fossa. The anterior cranial fossa is mainly formed by the frontal bone, which is the broader bone of our skull, and parts of the ethmoid and the sphenoid, like the lesser wings of the sphenoid, form part of this anterior cranial fossa. Now, the middle cranial fossa, which houses the temporal lobes, the lobes of the brain that are in contact with the temporal bones, these are, the middle cranial fossa is formed by the sphenoid and the temporal bones. And in here, in this middle cranial fossa, we have a lot of openings through which nerves and blood vessels passes through. Now, the posterior cranial fossa is mainly made by the occipital bone, but parts of the temporal and the sphenoid. And in here, we have the support of the cerebellum and the brainstem. The cerebellum is a tiny organ that we have posterior and inferior to the brain, and it helps to maintain balance and helps to coordinate fine movements. The brainstem, it's a part of the nervous system that holds different centers that help us to breathe, to maintain a specific heart rate, and also to control blood pressure, among other functions. And also help us to keep the condition of being awake. So here's the lateral view of the cranial fossa. So if you remove the bones of the skull laterally and you see this cranial fossa, so this will be the anterior cranial fossa that houses this frontal lobes. And then here we have the middle cranial fossa that holds these temporal lobes. These are the temporal lobes of our brain. And here we have the posterior cranial fossa that holds the brainstem and the cerebellum, which is this, and kind of part of the occipital lobes as well. This part, guys, it is the base of the cranium. And this is the cranial vault, or calvaria. So floor versus roof. Okay, any questions so far? So before I tell you the details of these bones, don't get intimidated by the number of bones, because most of the bones are paired. So from those 206, you can roughly call it 103. If you take into account that from those 103, you have to take out 12 ribs, which they don't have a specific name, that leaves you to 91 or so, right? If I'm doing math correctly. And then, from those 91, if you take out 5 metacarpals plus, 19 phalanges, that would be 24. So from 91, you deduct like 24, that leaves you with 60, something like 70, let's say. And then if you do that the same for the feet, then you get more, reduce the number. So it's very few bones that you have to learn, and the names are not hard. Okay? So, and you will do that in the lab. You will practice more of this. So now, this is then the anterior view of our facial bones and skull bones. And for the frontal, this medial part of the frontal between the eyebrows, this is called glabella. This is a marking of the frontal. And then part of the frontal will be the supraorbital foramen. And this will be the supraorbital margin. Why it's called supraorbital? Supra means above the orbit. Margin because it's an edge. So this is the supraorbital margin, this is the supraorbital foramen, and this will be the glabella. All of these are markings of the frontal. And this part of the frontal, like the most prominent part, this is the squama. Now, for the sphenoid, you can see here this marking that is called the supra or superior orbital fissure. And then we have a tiny canal that is called the optic canal. This optic canal allows the passage of a nerve that is called cranial nerve number 2, which allows us to see. It passes through this optic canal. So those are parts that you can see from the sphenoid. And now, for the ethmoid, you just see the ethmoid, so you don't see features in this view. Nasal bones, they don't have features. Now, for the ethmoid, in the orbit, you just call it ethmoid, but in this part of the ethmoid, in the nasal cavity, you have the perpendicular plate of the ethmoid, which runs like this in our nasal cavity, helping to divide the nasal cavity into right and left. And below the perpendicular plate of the ethmoid, we have the vomer. So both the vomer and the ethmoid divides then our nasal cavity or the cavity of the nose into left and right. And then in here we have the inferior orbital fissure, which is made by several bones of the orbit. And now for the zygomatic, you can see it inferior and laterally here in the orbit. And then maxilla, it is this broad bone from the face. And then here you can see in the nasal cavity, which is this, the inferior nasal concha. And then here we have the mandible. The mandible has this feature in here that is called the mandibular symphysis, and it has the mental foramen, superior and lateral to the symphysis. So this is the symphysis, and then here, just below your canines, you have the mental foramen. If you compress for a while just below your canines, a little bit there, you start feeling numbness. You can feel numbness right away from your lower lip. The mental nerve exits through here and provides innervation to this area. Typically, when you compress nerves, you can have a sensation of numbness. Now, the markings where our teeth fits into, whether it's in the mandible or if it's in the maxilla, are called alveolar processes. So these are the alveolar processes. Now, this part of the mandible, the broad part, this one, is the body. And this part is called the angle. So this is the angle, and this part that goes up is called the ramus. It's not labeled in here, but those are features that you will be able to see in the anterior view of the mandible, and this is the temporal bone. And then, of course, here we have the parietal. So the lateral view of the skull. Here is the temple area, and this is the temporal bone. So we can see some sutures, which are connections between bones. Like this one, this is the coronal suture. The coronal suture is the connection between the frontal and the parietal. And then this connection between the temporal bone, which is this, and the parietal is called the squamous suture. And the connection between the occipital bone and the mastoid process of the temporal bone, which is this, is called the occipitomastoid suture. And the connection between the parietal and the occipital bone, which is this, it is the lambdoid suture. So what else can you see in the lateral view? Well, the nasal bones again, lacrimal bones with the lacrimal canal in there. And then this spine, this sharp projection of the maxilla, which is called anterior nasal spine. And then in here, we have the zygomatic and the temporal bone forming an arch, which is called the zygomatic arch. So the zygomatic bone has the temporal process, and the temporal bone has the zygomatic process, that when they connect, they form the zygomatic arch. And then here are the alveolar processes of the maxilla, alveolar processes of the mandible. And this is the mental foramen, mandibular symphysis, mandibular body, mandibular angle, mandibular ramus. Then this is mandibular condyle feeding into the temporal fossa or mandibular fossa, forming the temporomandibular joint. And this is the conoid process of the mandible. Between the conoid process of the mandible and the mandibular condyle, we have the mandibular notch. Now, for the temporal bone, so we have this region that is called the squama, and then we have here the external acoustic meatus, which forms the opening so that or canal, so that the sound waves goes through there internally and hit the tympanic membrane, so that the tympanic membrane vibrates and then we can hear. And then posterior to this external acoustic meatus, we have this triangular projection, if you want to see it that way, that faces inferiorly the tip, the apex. So this is the mastoid process. The mastoid process is easily felt behind our ears. And then we have these powerful muscles in our neck that are called the sternocleidomastoid that actually inserts into here, into this temporal bone in the mastoid process. Middle ear infections that get complicated can go into this mastoid process, because inside the mastoid process we have a lot of holes that we call the mastoid cells, and the bacteria can lodge in there. It's typically a bacterial infection of the otitis media or middle ear infection. So when this happens, you have to have a surgery to drain the pus and the bacteria from this area, and it's not fun. This happens frequently in little children under the age of 5, so they can have mastoiditis. So then in here we have the occipitomastoid suture, and then here we have the external occipital protuberance, superior nuchal line, and inferior nuchal line. And here is the lambdoid suture between the occipital bone, which is the most posterior and inferior of the skull, and the parietal bone. Any questions? In the posterior view of the skull, we have different markings. So here are left and right parietal bones, and we have a suture between the left and the right parietals. This will be sagittal suture. And then you can see this lambdoid suture, which happens between the parietal bones and the occipital. And for the occipital, you have the superior nuchal line and the inferior nuchal line, and between the two lines, on the right and the left, you have this external occipital protuberance. Now, in these lines, we have connection of ligaments and muscles that helps to keep our head erect, like looking ahead. And now, below this, we have the greatest hole or foramina that we have in our skull bones and also in any bone. This is called the foramen magnum. Through the foramen magnum, we have the exiting of the spinal cord or the entering of the spinal cord, depending on how you want to see it. But here we have the foramen magnum, and then on the sides, we have the occipital condyles that helps for articulate with the first cervical vertebrae that is called the atlas. And then here you can see the squamous suture between parietal and temporal bone. Any questions about the posterior view? In the inferior view of the skull, you can see again the occipital bone. This is the superior nuchal line, inferior nuchal line, external occipital protuberance, foramen magnum, occipital condyles, and then here we have the hypoglossal canals that allows the exit of the hypoglossal nerve, which is the one that innervates our tongue so we can move the tongue muscles and we can speak. And then here we have the occipital mastoid suture. This is the mastoid process. And then here is the carotid canal for the temporal bone. Here is the jugular foramen. And this is the styloid process. And in between the styloid process and the mastoid process, we have the stylomastoid foramen. Sorry, this is foramen lacerum. This is the jugular foramen. And then here, this little foramina will be the stylomastoid foramen. This is the mandibular fossa, so the mandibular condyle articulates in here. Foramen lacerum made by different bones, the occipital, sphenoid, and the temporal in here. This is the sphenoid, and here we have the vomer. And here's the palatine bone. This is the inferior nasal conchae in here. And then here we have the maxilla. This is the incisive fossa, alveolar processes. This is the zygomatic arch formed by the zygomatic bone, that temporal process, and the zygomatic process of the temporal bone. And then here is the medial pterygoid process of the sphenoid. This is the lateral pterygoid process. This is the foramen ovale. A major nerve passes through here, which is cranial nerve number 5, the mandibular branch. Here's the foramen spinosum and foramen lacerum. So that's all that you can see in this inferior view. Internally, again, you can see all these fossas, anterior, middle, posterior fossa, and then you can see the perpendicular plate of the ethmoid and then the vomer forming the nasal septum, the bony nasal septum. And this is the floor of the, roof of the oral cavity. This is the hard palate made by the palatine bone and the maxilla here. And here we have a submandibular fossa for the submandibular gland. And it's not labeled in here, but in the body of the mandible, we have the mandibular foramen. The inferior alveolar nerve, part of the cranial nerve number 5, the trigeminal, passes through here so that it provides innervation sensation to this lower area of our oral cavity. So doctors numb this to extract teeth, the dentist, to extract teeth from the mandibular area. And then this is the internal acoustic meatus from the temporal. And this is part of the ethmoid, the perpendicular plate. So foramen magnum, posterior cranial fossa, then the hypoglossal canal, internal jugular foramen, foramen spinosum, ovale, rotundum, optic canal, lesser wings of the sphenoid, greater wings of the sphenoid. Then this is the ethmoid, cribriform plate of the ethmoid, and this is the frontal. Middle cranial fossa here, and then anterior cranial fossa here. Any questions? This is the last slide for today. Bones of the orbit, we have 7. Frontal, maxillary, zygomatic, sphenoid, ethmoid, lacrimal, palatine. Functions of these bones to protect the eye and anchor the muscles of the eye. These bones in general are very tiny. If someone has a traumatic injury of the orbit, the repair is going to be hard because imagine to reconstruct tiny bones, put them back together. So typically when people has an injury to the orbit, you will have some sequelae or consequences. Now the nasal cavity is made by the ethmoid, the perpendicular plate that we saw before, vomer, nasal bones, palatine bone, forming the floor of the nasal cavity, which is the roof of the oral cavity, and then the maxillary bones. And the function is to support the nose and help us to inhale air. Now we have around the nose openings in bones. That's another feature that I forgot to tell you, sinuses. Sinuses are openings within the bones that help us to have air, to lighten the skull, to provide an area where you can humidify the air. So these are air-filled cavities in the frontal bone, which are the second largest sinuses that we have. Maxillary, we have it in the maxilla, which are the largest paranasal sinuses. And we also have in the sphenoid, which is only one sinus, and then we have it in the ethmoid, and in the massive processes, but these are cells. These are tiny openings. Functions to lighten the skull, produce mucus, warm and filter and humidify the air. Any questions? Okay, so if you don't have